Moody.
Thank you, Mr. Speaker. I rise today to begin the third reading on Bill S-212, an act respecting a national strategy for children and youth in Canada. Colleagues, this bill, in my view, is among the most significant pieces of legislation we can move forward with this Parliament. That is because it's not only about supporting the Government of Canada in its efforts to develop programs for children and youth, but it is about ensuring a vision and a plan so that every child in Canada has an opportunity to succeed and prosper. We have over 8 million children in Canada. They are our most precious resource, and they are critical for Canada's economic growth and economic sovereignty. As I and many of our colleagues have emphasized many times before, Canada continues to lack a coherent, long-term national vision for our children and youth. Throughout my consultations on this bill with young people, parents, advocates, and Indigenous leaders and youth, a recurring theme kept coming forward. Without a clear vision, we are failing our children and youth in providing opportunities and creating the space for them to succeed in our country. Each of the groups that I consulted were very clear. Canada needs a national strategy that brings together the patchwork of programs, benefits, and programs throughout the country under one outcome-driven framework. Without such a strategy, we risk continuing with siloed interventions, short-term fixes, and duplication of efforts that fail to address the real issues facing children and youth, including poverty, housing, mental and physical health, and education, and we will always end up short of reaching our goals. Public investment in Canada's children and youth has shown to be an efficient and assured mechanism to grow Canada's economy. Investments in childcare, youth services, and education act as a powerful economic engine. Data from TD Bank Economics and the Government of Canada's Department of Finance indicate that every $1 invested in these programs, Canada's gross domestic product increases by $2.30, outperforming sectors like construction and manufacturing. In the short term, the investments in children and youth would immediately remove barriers for women to join the workforce. This would grow Canada's labour pool and our overall economic output. When the Government of Canada introduced the Early Learning and Childcare Program in 2021, its own analysis estimated that investments in this program will support as many as 240,000 more Canadian women into the Canadian labour market and increase real per capita GDP in the long run by as much as 1.2%. In the long term, the same data shows that investments bring a 13-to-1 return on our investment. Studies from the University of Toronto and UNICEF Canada shows that these returns become realized through increased lifetime earnings, potentially increasing earning by 25%, and by reducing government spending on health care and social services. Colleagues, the evidence is clear. Investments in education, health, and youth services for children and youth directly fuels our economic productivity. The more we support our children and youth, the more we develop a stronger, resilient, skilled workforce. However, Canada's current approach to supporting our children and youth operates in a fragmented, asymmetrical model, with this patchwork of programs, benefits, and policies across provinces, territories, and the federal government. As a result, we see a limit to the kind of progress that we have all made collectively over the past few years. To give you an example, the implementation of the National Childcare Program, despite the Government of Canada's commitment to ensure that every family in Canada has access to affordable and safe childcare, each province and territory are in very different stages in implementing this program. And some have even opted out to not to do anything or very little about childcare at all. The urgency for this strategy is also underscored by the alarming data from UNICEF Canada's most recent report. UNICEF ranks Canada 19th out of 36 high-income countries when it comes to supporting our children and youth, demonstrating that our children are not faring as well as many of our peer countries. Some of the more alarming statistics in the report include children's life satisfaction declining from 79 to 76% since 2018. We've also made minimal gains in addressing childhood obesity, social skills, and adolescent suicide. Most alarmingly, Canada has slid from 23rd to 25th out of 43 peer countries in addressing the rate of child mortality. These are not insignificant issues. These statistics represent deep systemic failures of Canada's fragmented system. We are failing too many children when it comes to their health, well-being, and mental health. So let me be clear on what Bill S-212 does and does not do. It does not appropriate money, nor does it tell the government of Canada what the strategy should be. Rather, it establishes a legislative framework for the government to develop a strategy, including the kind of stakeholders the government of Canada must engage with in developing the strategy. It would require that the government consult broadly, especially with children and youth, with caregivers and families, with Indigenous governing bodies, with provincial, territorial, and municipal governments, and other experts in the children and youth space. Bill S-212 mandates that the strategy include measurable goals, quantifiable indicators, a detailed plan of action, and a resource map for how it would be implemented. It builds on the accountability tools called for by UNICEF and Campaign 2000 by ensuring that the government provide a progress report every 6 months to Parliament until the strategy is published. This kind of parliamentary oversight provides a mechanism for children and youth to ensure that their voices are included in the development of this strategy. Finally, S-212 anchors the strategy in a rights-based approach, aligning with Canada's obligation under the United Nations Convention on the Rights of the Children, the United Nations Declaration on the Rights of Indigenous Peoples, and the United Nations Convention on the Rights of Persons with Disabilities. In short, this bill lays the foundation for a child-centered, coherent, accountable, and long-term national framework. Throughout the bill study at Sochi, we heard powerful testimony from clinicians, youth advocates, service providers, Indigenous leaders, and mental health advocates. At the outset, I'd like to give my sincere gratitude to Senator Greenwood, Senator Hay, and Senator Petitclerc for their thoughtful and enriching amendments. Your work has strengthened the bill, and as Senator Bury said, your additions help to ensure a deep commitment to improving outcomes for children and youth. Colleagues, witnesses at the committee agreed on the need for a strategy, but emphasized a couple of important facts that must be considered in developing the strategy. First, Indigenous communities must and should have their own distinction-based process that supports their unique realities and is informed by First Nations, Inuit, and Métis perspectives and knowledge systems. As Senator Greenwood said, there are numerous socioeconomic factors, including colonization, that significantly and disproportionately impact the health and well-being of Indigenous children. By incorporating indicators that are relevant to Indigenous children and youth and are informed by Indigenous perspectives and knowledge systems, we can ensure that the national strategy can fulsomely address the challenges that are unique to Indigenous children and ensure that they are not lost. The second major theme we heard from experts is the need for a strategy to include clear outcomes and quantifiable indicators so that progress is not just promised but tracked. This is especially important as we try to improve on the declining socioeconomic outcomes that have been reported on by UNICEF. Experts at committee spoke of the lack of access for children's health and mental health services. They also spoke of long wait lists, infrequent mental health check-ins from service providers, and confusion in navigating the healthcare system. As a result, The committee unanimously agreed to ensure that Bill S-212 address these concerns by including mental health, physical health, and children and youth with disabilities as an additional area that the Government of Canada must pay particular attention to when developing the strategy. Senator Bury said in her speech, "These amendments and observations together ensure that national strategy creates a vision that is inclusive, equitable, and responsive to the full diversity of children and youth across Canada." The third factor was raised at committee came from youth advocates themselves. They were clear that youth from every region of Canada must be at the table throughout the entire process in developing the strategy. This means going beyond just being consulted. Children and youth deserve meaningful opportunities to determine their own future, which includes a leading role in developing the strategy that's specific to them. Finally, witnesses were clear that the strategy must emphasize the principles of equity, implemented rights-based approach, and include strong accountability mechanisms to ensure the Government of Canada is achieving their goals. As Senator Senior pointed out in her observation, children are not inherently poor. Rather, they experience poverty through their living conditions, often single-parent households headed primarily by mothers. It is poverty within these situations we need to address. Particularly for Indigenous and racialized youth, children with disabilities, and for children experiencing poverty, witnesses at committee stressed the importance that the strategy be grounded at its core in the Convention on the Rights of the Child, the United Nations Rights on Indigenous People, and the United Nations Convention on the Rights of Persons with Disabilities. With these additions, S-212 now provides even more tools for the Government of Canada to develop a strategy for children and youth. And this is a good thing for our communities, for our children, and for Canada. I'd like to thank the committee members for their hard work that has strengthened the bill and will ensure that no child or youth is left out. Colleagues, as I have consistently stated since I introduced this bill a few months ago, the case for a national strategy for children and youth could not be clearer. We are not doing what we should be doing to ensure that our children have everything they need to be successful and prosperous. The data is clear. Canada's fragmented system is not benefiting our young Canadians. Without a unified vision, we run the risk of repeating the same mistakes of the generations before us and missing an opportunity to finally make a meaningful difference in the lives of our children, to push our goals to that finish line that we all desire. Honourable Senators, again, quoting Senator Bury in her third reading speech, we have a chance to take the baton from the former Senator Langdon Pearson in the relay race that is the life of our country and ensure that our children have the brightest future possible with no child left behind. A national strategy, you see, is not a luxury. It is essential if we truly care about equity, well-being, and ensuring that all our children have the opportunity to thrive. I urge you to support Bill S-212 without reservation. In doing so, we send a strong message to Canadians and to our children and youth that we are serious about their future. We will demonstrate to our young people that we recognize the urgency to take care of their needs. And we will demonstrate that we are willing to commit to a long-term plan that will ensure that every child in Canada has a chance to be prosperous. We are not simply voting on a bill, colleagues. We are voting on a vision for Canada, where every child has access to good, quality health care, where mental health services are timely and equitable, where every young person's rights are respected, and where governments across Canada are held accountable for the future of our young people. Mr. Speaker, honourable senators, children do not choose the circumstances into which they're born. They cannot vote, and they do not have a direct voice in this chamber. But we, as senators, have a profound responsibility to do all we can as legislators to ensure our children and youth have everything they need for their future. We must act out of justice, accountability, and a demand for a national vision for our children. As a community, we must create a framework that ensures that no child is left behind. Bill S-212 is that legislative tool to do precisely that. We should seize this moment and move ahead with this bill, Bill S-212. Thank you, Senators.
Are senators ready for the question?
It was moved by the Honourable Senator Moody, seconded by the Honourable Senator Forêt, that the bill as amended be read a third time. Is it your pleasure, Honourable Senators, to adopt the motion? Oui. Adopté, carried.